Kidney stones, a painful and often terrifying experience for many. Imagine living a healthy life, only to suddenly be struck by sharp, excruciating pain in your back or side. This pain, often referred to as one of the worst you can experience, is caused by kidney stones. But the good news is, with the right knowledge, kidney stones can be prevented. Understanding exactly what kidney stones are, how they form, and why they're a bigger concern for seniors is the first step in protecting yourself from this painful condition. In this video, we'll break down how kidney stones develop, and share essential tips on how you can avoid them, so you can keep living life to the fullest, without that constant worry in the back of your mind. 1. Understanding kidney stones. Before we dive into the foods that can cause kidney stones, it's important to first understand exactly what kidney stones are, how they form, and why they're a problem, especially for seniors. Knowing this will give you the context to better manage and prevent them. Kidney stones are small, hard deposits that form in your kidneys when your urine becomes too concentrated with certain substances like calcium, oxalate, and uric acid. These substances crystallize and form solid, stone-like particles, which can vary in size. Some stones are as small as a grain of sand, while others can grow large enough to block the urinary tract, causing pain, bleeding, or even kidney damage if not treated properly. How do kidney stones form? Kidney stones can develop in a few different ways. There are primarily 4 types of kidney stones. 1. Calcium oxalate stones, the most common type, formed when calcium combines with oxalate, a substance found in like spinach, beet nuts. 2. Uric acid stones, these form when uric acid, which is a byproduct of protein metabolism, becomes too concentrated in the urine. 3. Struvite stones, these stones typically form as a result of urinary tract infections, leading to a combination of magnesium, ammonium, and phosphate. 4. Cystine stones, a rare type of stone that forms in people with a genetic disorder called cystinuria, which causes excessive excretion of cystine in the urine. For most seniors, calcium oxalate stones and uric acid stones are the primary concerns. This is because calcium is a normal part of our diet and uric acid is produced when the body breaks down animal proteins. As we age, our kidneys can become less efficient at processing these substances, making it easier for them to build up and form stones. Why are kidney stones a bigger problem for seniors? Kidney stones can affect anyone, but seniors are particularly vulnerable for several reasons. 1. Decreased kidney function. As we age, kidney function naturally declines. This means the kidneys are not as efficient at filtering out waste, which can lead to an increased risk of stone formation. In fact, kidney stones become more common as we reach our 60s and beyond. 2. Dehydration. Seniors are more likely to become dehydrated, which is one of the leading causes of kidney stones. When you're dehydrated, your urine becomes concentrated, and the substances that form stones have a higher chance of crystallizing. 3. Medications. Certain medications that are often prescribed to seniors, such as diuretics, which increase urine production, can increase the risk of kidney stones by reducing the amount of fluid in the body. 4. Other health conditions. Health problems like high blood pressure, diabetes, and obesity can also increase the risk of kidney stones. Additionally, conditions like hyperparathyroidism and chronic urinary tract infections can further contribute to stone formation. The symptoms of kidney stones, what to watch for. While kidney stones can often be silent, meaning they don't show symptoms until they begin moving, there are several signs to look out for. 1. Severe pain, often described as one of the most excruciating pains a person can experience. Kidney stone pain is sharp and sudden. It typically starts in the back or side, near the ribs, and may radiate to the lower abdomen or groin. 2. Blood in the urine. When the stones move, they can scratch the lining of the urinary tract, causing blood to appear in the urine. This may look like pink, red, or brown urine. 3. Frequent urination or painful urination. As the stone moves closer to the bladder, you may feel the need to urinate frequently or feel a sharp pain when you urinate. For nausea and vomiting, the pain caused by kidney stones can also lead to nausea and vomiting as a secondary effect of the body's stress response. 5. Cloudy or foul-smelling urine. This can be a sign that an infection is present, which is particularly concerning with kidney stones. Let's take a moment to hear about Mrs. Margaret, a 71-year-old retiree. She had always been healthy, but one day she experienced intense pain in her lower back, which she thought was just a muscle strain. However, after a visit to the doctor, it was discovered that she had a kidney stone the size of a marble. The pain she experienced was so intense that she couldn't even sit down comfortably. It wasn't until after a few tests that her doctor explained the stone's presence and the potential risks. Margaret learned that kidney stones aren't just a one-time problem, they can recur, and once you've had one, you're at a higher risk of developing more in the future. The importance of early detection and prevention. While kidney stones are very treatable, it's always better to prevent them from forming in the first place. Early detection, regular checkups, and making some dietary and lifestyle changes can significantly reduce the risk of kidney stones, and for seniors, these measures can help you lead a healthier, more comfortable life. 2. The foods to watch out for. Now that we understand what kidney stones are and seniors are at a higher risk, let's talk about the foods that can contribute to the development of kidney stones. Some foods that are generally healthy can, in excess, increase your risk, especially if you already have risk factors for kidney stones. But don't worry, I'm not saying you need to cut these foods out entirely. The key is moderation. Let's break down the major culprits. Salt, the silent trigger. Salt is essential for your body to function properly, but many seniors unknowingly consume too much of it. Processed foods, canned soups, fast food, and even restaurant meals often contain high levels of sodium. And here's why this matters: when you eat too much salt, your kidneys have to filter more calcium, and this can increase the likelihood of forming calcium-based kidney stones. Take Mr. Mark, a 70-year-old who loved adding extra salt to his meals, from morning toast to dinner salads. Over the years, he noticed that he was experiencing more frequent back pain and trouble urinating. After a visit to his doctor, Mark found out that he had developed several kidney stones. His doctor advised cutting down on salt, particularly from processed snacks and restaurant meals. After switching to a low-sodium diet, Mark reported feeling better and noticed less frequent kidney issues. Instead of reaching for the salt shaker, try using herbs and spices like garlic, oregano, or rosemary to add flavor. Also, choose fresh foods over processed options to control your sodium intake. Oxalate-rich foods, the hidden risk. Oxalates are naturally occurring compounds found in many healthy foods. However, for people prone to kidney stones, too much oxalate in the diet can increase the risk of forming calcium oxalate stones, the most common type of kidney stones. Some foods that are rich in oxalates include spinach, rhubarb, beets, nuts, and chocolate. While these foods are full of nutrients, eating them in excess can be problematic. Ms. Linda, a 68-year-old woman, loved to make large spinach salads and drink beet juice every morning. She believed she was doing wonders for her health. But after experiencing multiple episodes of kidney stones, she consulted with her doctor, who pointed out the high oxalate content in her diet. After reducing her intake of spinach and beets, Linda noticed fewer issues with her kidneys. The key, her doctor explained, was moderation. If you're prone to kidney stones, it doesn't mean you have to give up spinach or chocolate forever, but try to balance your intake with other low-oxalate foods. Consider foods like kale, broccoli, and sweet potatoes instead, which are nutritious but lower in oxalates. Animal protein, too much of a good thing. Animal protein is essential for your body, but eating large amounts of it, particularly red meat and poultry, can put excess strain on your kidneys. Animal proteins increase the amount of calcium and uric acid in your urine, both of which are known to contribute to kidney stone formation. Additionally, when you consume too much animal protein, the body tends to excrete more calcium into the urine. This is especially concerning for seniors, as it can lead to the formation of calcium-based kidney stones. Mr. George, 74, had always been a steak lover. He ate red meat at least 3 times a week and regularly included chicken in his diet. But after several painful kidney stone episodes, his doctor advised reducing his intake of animal protein. By switching to more plant-based proteins, such as beans, lentils, and tofu, George found that his kidney stone problems lessened. Not only that, but his overall health improved too. Try replacing some of the animal proteins with plant-based options. Incorporating more beans, tofu, quinoa, and legumes can provide you with essential proteins without putting strain on your kidneys. High sugar and soft drinks, a sweet trap. High sugar intake, particularly from sugary drinks, is another risk factor. Studies have shown that sugary beverages, including sodas, fruit juices, and energy drinks, can increase your chances of developing kidney stones. Sugar, especially fructose, increases calcium excretion in the urine, which can promote stone formation. Moreover, sugary drinks are often filled with other chemicals and artificial sweeteners, which can add to the problem. Mrs. Helen, 76, had been drinking soda throughout her life. It was her go-to drink with every meal and snack. But over time, she noticed that she was frequently suffering from kidney stones. After speaking with her doctor, she learned that excessive sugar consumption, especially from soda, was contributing to the formation of her stones. Helen switched to water and herbal teas, and within months, her kidney stone problems improved significantly. Try to limit your intake of sugary drinks and sodas. Opt for water, herbal teas, or infused water with a slice of lemon or cucumber. Not only will this help your kidney health, but it will also contribute to better overall hydration. High-fat dairy, the calcium dilemma. Calcium is crucial for bone health, especially as we age. However, consuming too much calcium from high-fat dairy products, such as whole milk, cream, and cheese, can increase your risk of kidney stones. This is because excess calcium in the urine can lead to the formation of calcium-based kidney stones. While calcium is necessary for the body, the key is to get it from the right sources and in the right amounts. Take Mr. Ralph, a 78-year-old man who loved his daily serving of cheese and rich milk-based sauces. Over the years, he started experiencing recurring kidney stones. After consulting with his doctor, Ralph learned that his high-fat dairy intake was contributing to the problem. By switching to low-fat dairy and incorporating more plant-based sources of calcium, like leafy greens and fortified almond milk, Ralph reduced his stone episodes significantly. Consider switching to low-fat dairy products or plant-based alternatives like almond milk or fortified soy milk. These options provide calcium without the excess fat and can help keep your kidney stones at bay. 3. The power of prevention. Now that we've covered the foods that can increase the risk of kidney stones, let's shift gears to focus on how we can prevent them. The good news is that kidney stones are largely preventable with the right habits, lifestyle changes, and food choices. Prevention is not just about avoiding the wrong foods but also about making the right decisions every day for your overall health. Stay hydrated, the key to dilution. One of the simplest yet most powerful ways to prevent kidney stones is to stay hydrated. Drinking plenty of water helps dilute the substances in your urine that can form stones, such as calcium and oxalates. When you're well hydrated, your urine stays diluted, reducing the chances of these substances crystallizing into stones. For seniors, staying hydrated is especially important because dehydration can easily occur, even without obvious signs. As we age, our bodies tend to lose the feeling of thirst, and this can lead to dehydration without us even realizing it. Take Mr. Dan, 72 years old. He used to drink very little water and mostly relied on coffee and sugary drinks. After experiencing frequent kidney stones, he decided to make a change. Dan started drinking water regularly throughout the day, even setting a timer to remind him. In just a few months, he noticed a significant reduction in his kidney stone episodes. His doctor confirmed that staying hydrated had made a major difference. Experts recommend that seniors aim for at least 8 cups of water a day, but this can vary depending on your health needs and activity level. If plain water feels boring, try adding a slice of lemon or cucumber for flavor. Balance your diet, get the right nutrients. As we've discussed, some foods are linked to kidney stone formation, but others can actually help protect your kidneys. A balanced diet is essential in preventing kidney stones, especially one rich in fruits, vegetables, and whole grains. Certain foods can help reduce the concentration of substances in the urine that form kidney stones. For instance, foods high in potassium, like bananas, sweet potatoes, and spinach, can help prevent stone formation by lowering the excretion of calcium in urine. Additionally, consuming foods high in magnesium, such as beans, nuts, and whole grains, can help prevent kidney stones by reducing the risk of oxalate crystallization. Ms. Joanne, 70, had struggled with kidney stones for years. Her diet mostly consisted of processed foods, and she wasn't getting enough fruits and vegetables. After a chat with her nutritionist, Joanne switched to a diet rich in potassium-rich foods like bananas and leafy greens, while cutting down on processed snacks. Within 6 months, her kidney stone issues significantly decreased. Make sure your diet includes a variety of fruits and vegetables, whole grains, and foods rich in magnesium and potassium. Avoid overly processed foods, and make sure to include high-fiber options, which can help maintain healthy kidney function. Limit animal protein and focus on plant-based alternatives. We've talked about the impact of animal protein on kidney stone formation. For seniors, switching to plant-based proteins can be a game changer. Plant-based proteins provide the necessary nutrients without increasing calcium or uric acid levels in the urine. Replacing red meat and poultry with options like beans, lentils, quinoa, and tofu can help reduce your risk of kidney stones while also offering numerous health benefits, like lower cholesterol and better heart health. Mr. Larry, 69, had been a long-time lover of meat. However, after learning about the connection between animal protein and kidney stones, he began substituting his meat-heavy meals with more plant-based dishes. Over time, Larry found his kidney stone episodes were much less frequent, and he felt more energetic and healthier overall. Gradually reduce your intake of red meat and poultry. Replace them with plant-based protein options like beans, lentils, chickpeas, quinoa, and tofu. These not only help with kidney stone prevention but also provide a wide range of nutrients. Watch your calcium intake, get it from the right sources. While calcium is an essential mineral for bone health, it's important to get it from the right sources and in the right amounts. Excessive calcium from supplements or high-fat dairy can increase the risk of kidney stones. Instead, aim for calcium from foods like low-fat dairy, fortified non-dairy milk, and leafy greens. It's crucial to get the balance right. While we want enough calcium to support our bones, too much calcium from supplements or fatty dairy products can raise the risk of kidney stones. Mrs. Carroll, 74, used to take calcium supplements because she thought it would protect her bones. However, after suffering from multiple kidney stones, her doctor advised her to adjust her calcium intake. By switching to low-fat dairy and consuming more calcium-rich vegetables, like kale and broccoli, Carol managed to reduce her risk of kidney stones. Avoid excess calcium supplements unless prescribed by your doctor. Instead, focus on getting your calcium from food sources, such as low-fat dairy, fortified plant-based milks, and leafy greens like kale, bok choy, and turnip greens. Exercise regularly, keep the kidney stones away. Exercise isn't just for weight loss or heart health. Regular physical activity is important for maintaining overall kidney health and preventing kidney stones. It helps improve blood flow to the kidneys, reduces the amount of calcium in your urine, and maintains a healthy weight. For seniors, this doesn't mean you need to run marathons. Even light activities like walking, stretching, or swimming can significantly help. Mr. Harry, 77, was living a sedentary lifestyle. After he began experiencing frequent kidney stones, he decided to make some changes. He started walking 30 minutes a day and doing gentle stretching exercises. Within months, he reported feeling better, his kidney stones became less frequent, and his overall health improved. Try to include some form of physical activity in your daily routine. Whether it's walking, yoga, or gentle swimming, staying active can help keep your kidneys in top shape. Now that you understand the risks and the factors contributing to kidney stones, remember that prevention is within your control. Simple lifestyle changes, like staying hydrated, adjusting your diet, and being mindful of your medications, can significantly reduce the chances of kidney stones forming. Early detection is key, and by regularly checking in with your healthcare provider, you can catch any early signs before they develop into something more serious. You don't have to live in fear of kidney stones. With the right habits and knowledge, you can protect your kidneys and enjoy a pain-free life. So take the time today to implement these changes. After all, your health is the foundation of your happiness, and taking care of your kidneys is just one step toward a more comfortable, fulfilling future.